we're taking care of our neighbors, we're taking care of each other's family members, and this is a small community, this is a small town, but it's an extremely busy department. We carry a large area. We get the level 1 patients, we get them all the time, but we have the support to stabilize and transfer when needed. We can see upwards of 80 patients a day. We have an amazing staff to work with here in this department. We have highly qualified ER doctors, mid-levels, and nurses. Another advantage that we have here in the emergency department is the help from our hospitalists. Our hospitalist program here really assists the ED physicians in streamlining the process to make patient admission up to the floor seamless. And it's something that I think is great for the community, and it's just another great asset that we have here at our hospital to help with the physicians.
I worked previously as a medical director for an emergency group downstate, and at one time was on as many as 16 hospital staffs. I chose to work at this facility even though I actually live closer to another city called Green Bay, Wisconsin. I also find that the work environment here is pleasant. The physicians and staff obtain and deliver high quality care.
We don't like our patients to wait. We like our waiting room to be empty, and we fight hard to do that. Not only for ourselves, but it's for our community. Another advantage that we have here with the hospitalists is they're available to learn from. And healthcare is lifelong learning, it's nonstop. And to get that from the physicians, to get it from the hospitalists, that's why I really love working here.
My name is Donald Jacobs. I'm a family doctor. I've been here since 1959, so this will be my 56th year. Of course, I'm here because I love it. I love the town, I love the hospital. I'm able to do the things I love to do the most. I've never had a job. I never feel like I'm going to work. And it's wonderful to be able to say that. I've never had a job.
I guess what drew me to this area was kind of a little bit more relaxed lifestyle. I get a lot of vacation here. I get to know everybody really, really well because it's a smaller health system, a smaller town. And everybody's really cordial and friendly and welcoming, so it's been really nice.
You do not find the kind of people that you find in the UP. I mean, you walk down the street, people look you in the eye, people smile at you that don't know you, people offer to help you that don't know you. I mean, that by far is the best part. You feel like your community is an extended family, and the values, people value family here, and just kind of bringing you back to your core values versus all the superficial things that we get caught up in.
I just love the natural beauty of the area because we have the 4 seasons. There is such a wide variety of outdoor activities we can participate in.
Where are you going to live that you can drive 5 minutes to your job and then walk out back when you get home and see turtles laying eggs in your yard? It's just cool. We're away from the traffic. We're away from any, crime, danger of a city. And as much as we love Milwaukee, there's also a lot of risk to living in a big city. And so it's really nice to be able to go, and you can go to an Admirals game, you can go watch the Bucks, you can watch the Brewers, you can drive to Green Bay, go to the Packers games. It's just a lot of fun, and it's nice to have that accessibility where it's an hour and a half away. It's such a cool option to be able to go to all those different places and come back home and not have the traffic and not have, the stress. And so I do really appreciate that part of the living as well.
We moved here to the Upper Peninsula of Michigan from Boston in 1996. We've raised 4 girls here. All of them went through the Briding Township schools. It's a great place to raise a family.
As a principal of middle school, I feel I have a very good perspective of the elementary, middle, and high school experiences. We have a very wide variety of curriculum, AP opportunities with dual enrollment and concurrent enrollment with local universities and community colleges. We have an excellent scholarship program, and we receive great feedback from our students. We have students that attend Harvard, Stanford, the University of Michigan, and they tell us they are very well prepared and are set up well for success beyond college as well. As a father and a husband, before we even had children, we looked at the Upper Peninsula as an area that we grew up. And we looked at the schools, the quality of life, and we chose Kingsford and Iron Mountain area because of the quality of schools. Just a great opportunity for us to remain close to home and have the exposure and experiences of city life not too far away.
My wife and I were at school in Lower Michigan. She's a physician assistant and I'm an optometrist, and so we're originally from Minnesota, so we were kind of looking at getting back to Minnesota, Wisconsin area. We both were offered positions and accepted those positions, so we went ahead and went for it. We didn't know anybody in the area, so we just kind of jumped in and moved to the area.
The Young Professionals of the Upper Peninsula was a fantastic opportunity to connect young professionals in the community looking for both volunteer and social outlets here in the community. So we meet on a monthly basis, and whether we're doing a tour of a local establishment or business here in the community, whether we're volunteering to assist in the community or just hanging out at a local restaurant together, fantastic opportunity to network, get together with other peers and professionals in the community, and really learn about what we have to offer here in our region.
The Young Professionals was huge for us. When we moved to town, like I said, we didn't know anybody at the time. So after about 3 months of being here, we were in touch with someone who was basically in charge at that time of the Young Professionals group, and they were organizing events. And so we went to an event and realized that there are a nice number of young people kind of our age. Really clicked with those people, felt very comfortable, and didn't really take long to make pretty good friends in the area. And there is a handful of nice professional opportunities that we were able to get involved with.
Dickinson County Healthcare System advocates for a relationship with our physicians that is truly a partnership. We are here to create an environment where physicians can practice great medicine, take care of our patients and provide access to our patients, and still at the end of the day have time to go to their families and their friends and spend quality time with them.
Not only is the patient our concern, the hospital is our concern, and the medical staff is our concern. The way that we help the medical staff are these rare resources is that we try to then take care of the patients as much as possible. So if a patient comes in with a broken hip, 2 o'clock in the morning, you don't get called. We'll see the patient, we'll take care of the patient, and so then when you come in the morning, my job is to hand that case to you as a silver platter, saying this lady is all ready and teed up for surgery. You do the surgery when you think it's appropriate. My job afterwards is then to take care of that patient. Once you say, give me the okay, I get them to the nursing home or back home or wherever it is, to the rehab unit that we're going to send them. And so we work closely with our fellow physicians to then take care of those cases. We do the same thing with nephrology and cardiology and the general surgeons. We admit most of those cases, and many of those, we admit all of their cases, and then are the primary driver of that care, and we use the subspecialists, those rare, valuable resources, when we really need them, and we work collaboratively with them to help take care of those cases.
We as a healthcare system are continually looking at ways to improve our quality. I think it's a combination of efforts. Again, I think administratively, we have to make sure we hire the right staff, that we recruit the right physicians, and then when that team comes together, you have to produce a quality healthcare product. We have to take care of this community. The fact that we've been able to accomplish, the Health Grades Award, which ranked us in the top 10% of hospitals, I think is another tribute to our efforts.
Dickinson County Healthcare System is very proactive in aspiring to the highest standards of excellence and quality. Toward that initiative, we are now engaging in preparation toward the population health initiatives that is being advocated by the ACA nationally. We have recently joined the NRACO, who is preparing us for population health in the future, and we have currently hired a care coordinator to assist our physicians in managing those patients that have complex medical and psychosocial needs. We are now placing computers in each office so that patients can rate their office visit before they leave to enable us to get real-time data that we can initiate actions to improve our quality scores and our customer satisfaction scores.
Take care of your patients. Now with the hospital practice, we don't worry about dollars. I can't tell you even what I make and what I earn, and I don't want them to worry about that. The bucks will take care of themselves. You take care of your patient, your practice will grow, and that's the emphasis.